In addition to CD57, what are the inflammation biomarker tests that you would recommend a chronic Lyme patient request of her physician to better understand their situation?
Well, there's several you can use. I mean, I usually do CD57. I usually do a C4A. I oftentimes do myeloperoxidase or MPO. IL-6 is an important one, both Lyme and the COVID infections. Fibrinogen, CRP, HSCRP. Those are basically the main ones. I tend not to do any of the fancier NF kappa and some of these other VEGF and things like that. Just I don't find them overly useful. I think by the time that I get a good history and physical on the patient and have a clear idea of what's going on based on their history, 80% of their history and maybe 10% more on the physical exam, I'm ready to make a clinical diagnosis and start therapy. And I think really the clinician who is very sure of themselves and very well experienced, if they've been doing this for 20, 30 years, their reliance on biomarker testing and laboratory testing is not as heavy as a newer clinician with less experience. Same thing if you go into the ER and you have abdominal pain, the emergency room resident who's got maybe less than a year of experience is going to order all these blood tests and a CT scan and ultrasound and all that to make a diagnosis. Whereas the doctor with the gray hair who's been at it for 40 years, he can lay hands on you and take a good history and probably make the correct diagnosis 90% of the time. So it's really clinician dependent on how many tests need to be ordered or should be ordered. And I think, unfortunately, my impression of some of the teaching institutions like the IFM and A4M, they tend to teach the novices to over-test. And I am training nurse practitioners all the time, and I try to teach them to use their noggin, their ears, and all the gray and white matter in between to come up with a clinical diagnosis, and only if they get into a quandary to do a test. And that's everything from functional medicine testing, stool, CDSAs, Lyme testing, etc.